Marie will soon. Marie is now adding new programs and conversations more and more week over week. So please take a quick peek at some of the other conversations going on. One of note is the Afro Brothers, which is literally a conversation looking to support Black and African American males. It sort of spawned from the topic of mental health, and it has grown into just a general conversation with young and mature men all over the country. So please share with your brothers and fathers and significant others that this conversation is going on, because we find it to be quite rewarding. Others to come. Thank you.
Excellent. Thank you. Afro Brothers is an exciting opportunity for husbands, brothers, friends to come and join the conversation. So let's jump right into today's call. I'm going to frame it up by saying this is about a diagnosis. And when we talk about diagnosis, that means that we've gone to the doctor probably because we've been having some signs and some symptoms that we are trying to deal with. And once we get to the physician and in their office, based on lab reports, physical examination, and talking with us, they're able to provide us with a diagnosis. And so today's conversation is not just a conversation about one diagnosis. It's not about a cancer diagnosis. It's not about Parkinson's disease diagnosis. It's not about Alzheimer's diagnosis, but it's a conversation to help guide us for any diagnosis and what we should be thinking about doing. So Leslie is going to give us some stimulus topics to talk about, some questions that we can ask and discuss, and we'll follow through. After this call, we will post on the website an Agency for Healthcare of Research and Quality has what is called the 5 things that you should be comfortable with, basically, when you have a diagnosis. That resource will be on the website. So you will be able to have access to that resource after this call. There are 5 things that we'll make sure you know are essential, but I'm sure Leslie is going to cover that. So Leslie, thank you once again for joining the call, and let's get started.
Yeah, and that's a wonderful resource, Lisa. I have that one in front of me actually too, because it's one of the best ones when you're facing just any diagnosis, as Lisa said. And, you know, what they recommend is the first step is taking the time you need. And I'd like to talk about that a little bit, but take it back also just a bit and talk about getting the diagnosis and the 2 different ways that can go. So you could get the diagnosis at your primary care office and then maybe be told you need to see a specialist. Or it could be that you get a phone call from primary care saying they're referring you to a specialist, and you actually get the diagnosis at the specialist office. So both things can play out, and they could be a little bit different in terms of how you want to think about it. If you know you're going to a specialist office, one of the best things you can do ahead of time, if you have a family member or a friend who can go with you to take notes, to be an advocate, to ask any other questions. And the reason for that is, you know, when you're going into something like this and then you get all this new information, it's just hard to take it all in. You can't remember everything that's said to you. And we all know this. You leave and you go, oh gosh, I should have asked this, or I can't remember about this. So if that's a possibility, that's great. When you're going to your primary care office, you know, you may not be expecting to get necessarily some new information like a diagnosis. So you may not have that family member with you. And in a situation like that, just up front, I want to say, you know, when you're talking to your primary care provider, particularly if they're going to send you to a specialist, asking, well, who should I see and why? Why do you recommend that person? So kind of getting that information up front. But going back to that wonderful resource that Lisa mentioned, and I want to follow that framework, taking the time you need. I think that just goes back to, and when we're talking about various diagnoses, so it could be something really serious, cancer, Alzheimer's, or something that, may be minor, but something very chronic that you're going to deal with lifelong, making sure that you take time away to process that, talk about it with a friend. If you get that information at a primary care visit or a specialist visit and you leave and you feel like you don't have enough information, you'd like to speak to your provider more, set up another appointment, feel okay doing that, or call, send an email through the portal and say, I just have a few more questions. And my experience is that most providers are absolutely willing to call and talk you through it after the fact. So did we want to add anything to that one, Lisa, to the step one, or should we move on? I want to let you jump in.
Okay, perfect. I
Mhm.
just want to ask after this one, if anybody has any questions about that initial comments that you were made. You just might go to your primary care physician and you're referred or whatever. Does anybody have any questions about that? Silence is golden. So we'll move on to step number 2.
Yeah, and I think that one is more straightforward. So if you look at the resource, step 2 is getting the support you need, and step 3 is talking with your doctor. And I think that, those can be reversed. However that plays out, the order is how it plays out. So I kind of wanted to jump to some of the questions you might want to ask, and then talk about support as well. I feel like it's usually, that's my experience, it usually kind of goes in that order. But the resource Lisa mentioned has some wonderful general ones, and then I have a few more that come from the American Cancer Society that you can use even if it's not cancer related. But before we jump into that too, just want to mention, if you're getting a diagnosis and it is cancer, or if you get multiple sclerosis diagnosis, any of these, you can go into Everyday Health and just type in whatever that diagnosis is and get all these resources. And then typically, a lot of diagnoses that you can get, there are groups like the American Cancer Society or American Diabetes Association that have fabulous resources for you, for caregivers. So this could be if a family member of yours gets a diagnosis, and you can go look up these resources for caregivers, print off, here's what I should ask, here's what I should know. So, one of the biggest things you want to ask is what is the actual name? What's the technical name of what I have, my condition, my disease, and what does it mean in plain English? And it's okay to ask it. I love that this resource says that. If someone's describing it and you're not understanding, you say, hold on. Can you explain that to me, just plain English, exactly what this means? And again, this is one I've seen it over and over. You'd be surprised how many times someone gets a diagnosis and they leave and they realize, oh gosh, I don't even know what it's called, because again, it's so much to take in. So having that person with you, I've had patients say, can I record this? And I'm fine with that. You can always ask, hey, can I record this with my smartphone? So you can play back that conversation. So what's the name, the actual name of what I have? What does it mean? And then, well, what's the prognosis? What's the outlook for the future? You can ask, what other tests do I need? And if so, what kind and when? And then what are my treatment options? So we're going from what exactly is it? What does it mean? What's the prognosis? How soon do I need to make a decision? What additional tests and what are my options? Other things that are really important when thinking about treatment options. Well, what are the risks and benefits? So often you'll think of it in terms of pros and cons. Medical people tend to think of it in terms of risks and benefits. Same thing, but you can ask, well, what are the risks and what are the benefits? And, most providers are going to be really upfront about that. Well, you do this treatment, there's a risk of this side effect, but the benefit is this. so that you can make an educated decision. You can ask, is there a clinical trial? Is there a study? You know, especially if it's something rare or more advanced. A big one you can ask, are there changes I'm going to need to make to my daily life? How's this going to affect my daily life? That's a huge one to know, and something, I mean, I don't typically think to ask that. What organizations? So you can ask that provider, what organizations do you recommend for support? Where should I look for information? You can ask them that. And then what resources do you have? So a lot of times, you know, I know where I've been in clinic before, I come from the oncology side. We have nurse educators and they have tons of resources, and they'll have resources about the treatment options, and you can meet with that person. And in my experience, that educator will call you back anytime you call in. They're always available for you. So that's a big one. And then, you know, I wanted to, another one, you can ask about your insurance treatment costs. So the provider probably, they may not know the answer, but a lot of times there's a patient advocate wherever you are, and it's their job to look into that. So if that's, you know, something that's coming up for you, ask about it. Feel free to ask about it. And then another big one, this comes from the American Cancer Society, but again, this can be used anywhere. What's the goal of my treatment? So that's a big one to know, because the goals could be different. You know, is this so that I feel better? Is this so that I can, you know, get out and play tennis or play golf and do movement like I used to do? And I mention that because a lot of times patients have very different goals about what's important to them and what they want to be able to do, and that can affect your treatment choice. So before we kind of jump to support, yes, questions. Any questions?
If you don't have questions, I have two comments as it relates to what we're talking about with asking questions and understanding. Health literacy is an important topic right now. And when Leslie said, tell me my diagnosis so I understand, sometimes we feel we're being talked down to or not spoken to in a way that everybody that, you know, like a physician is like talking down. It's like me going to talk to Juanita about some accounting things, and she starts talking in accounting terms and I am clueless to what she's saying. But then when she says, you just need to add and subtract, divide and multiply, and then I get it, but I don't want to be made to feel like it's a condescending conversation. But if someone speaks to us in that way, I want us to feel comfortable, because the smartest of individuals don't understand medical terms and terminology. So let's take a step back and be willing to listen with different ears, so that when the offices are providing us with that information, we hear. What Leslie provided just now was all those questions. And what she told us before was, take a friend, take somebody else, because you're not going to remember those questions. So if you have a friend or a buddy or a spouse or a companion who you can talk with beforehand, get your list of questions together and go with that list together. I think that's a very good plan. Now you will have on Berea this resource that has this list of 10 questions that you can now ask and use and share with others if you're looking for a way to do that. So I wanted to emphasize those 2 points.
Lisa, I
Yes.
have more of a comment than a question. With the MyChart and other technology, sometimes when you go in for your tests, they may come out on the MyChart before the doctor sees them. I mean, that happened to me. So I'm at 5 o'clock in the morning, just reading my chart, and I see this thing out there, and it freaks me really out. And of course, you can't talk to anybody until 9 o'clock, and you're always talking to the wrong person. So I don't know if that will change. I've talked to my doctor about it. She said, "Well, yeah, that's what happened. With the new technology, when they do the test, they put them out there. So sometimes you see it before I see it, and sometimes the terminology is such that I don't know what it is."
Mm-hmm, mm-hmm.
And that's just a comment. I don't know if there is an answer.
It's a comment that is a very valid comment. Where I'm sitting and Leslie's sitting, we're bringing it up, especially as it relates to disturbing information and not knowing what to do with that information ahead of time. So we're trying to approach the automated delivery systems to see if that information can be scheduled at a different time, or we're having those conversations, but it's an automated system that delivers it after XYZ. But thank you for bringing it up and having the confidence to share that with your clinician, to say, this is how I was made to feel. I was with a patient recently who was sharing her story, and that's how she got her diagnosis of cancer, and had never talked with anyone. And here is someone who is a PA, ERPA, not a cancer PA, but got that. And she was like, "Oh, I'm a patient now. I can only imagine now how others may be feeling." So thank you, Mary, for sharing that.
Yeah, that's a wonderful comment. And I'll tell you, most providers actually don't like that's the functionality. It came out of a good place. So the, different laws and policies that were passed, it's because your chart as a patient is yours. All of that information is yours. It belongs to you. So the idea was for this transparency, but then some of the systems spit it out, just like you said, Mary, before the doctor sees it. And there I would say, sometimes I'm a person who wants all the information, but then there are times when I just think I'm not going to look at that. I'll wait till they call. And that's about, saying that to your provider is great, letting them know, so that could possibly change things in the future. And then otherwise, just, you could take the route of, I'm going to wait until I get a phone call, but sometimes that's really hard to do. And I saw a question in the chat about second opinion, which is such a great question, because I definitely was going to hit on that. And I think this is a great place to hit on it, because let's say that you go in. I love what Lisa said about having someone with you, or you yourself take the list of questions with you. I do that now myself because I forget if I don't do it. So I'll take a list if I go see my primary care, what are all the things I wanted to mention to her? What did I want to bring up? Because I forget if I don't do it. So take the list. And again, if you go and get a diagnosis and you weren't prepared for it, book another appointment and take the list, go back, call them with the list. But if you are in that situation and we're thinking about second opinion, there are a few scenarios when you would certainly want to seek out a second opinion. So, one would be if you feel like you're not being listened to, you just don't feel a connection with that provider. There's just a lack of trust, get a second opinion. Another time would be if it's something life-threatening, something that's a really big deal diagnosis. And it's good to get a second opinion and cover your bases. There are times health insurance actually requires second opinions for some things. Another time, if diagnosis is unclear, if you have a lot of, we would say comorbidities, but if you have a lot of, like, say you've got hypertension and high cholesterol and diabetes and just a lot of different things going on, you might want to seek out a second opinion for your treatment options and how this one treatment might affect something else. So those things are a big deal. And also, just if you want peace of mind, a lot of medical experts will say that one of the best times for a second opinion is just when there's not a perfect answer. So I can tell you that, let's say, for example, because this is my world, with certain cancers, and maybe it's an early stage cancer, it can be incredibly straightforward about exactly what you do. There are guidelines for that. But then, and maybe that's like a very common cancer, but if there's something really rare, or maybe you've had a recurrence, it may not be as straightforward. You have a lot of options. And so that could be a time to seek a second opinion. And it's hard to ask for a second opinion. It's hard for me to ask. We feel like, I don't know, you feel like you're cheating on your provider or something. But I will tell you, a good provider is absolutely 100% okay with you getting a second opinion. Where I've been before, we have even worked with teams. So we might have a patient with a certain type of cancer, and we know there's a study going on at Duke, or we know there's something at MD Anderson. That patient flies there, and we coordinate with that team, speak with those providers. If you have a good provider, they're okay with it. And if a person balks at your request, then maybe that's not the best provider for you. So a few different ways you could kind of approach that. You could just say, hey, before I start treatment, I'd just love to have a second opinion, just, for my own peace of mind. Is there anybody you recommend? You could ask your primary care. You could say, hey, if you had this yourself, is there another doctor, another specialist, anybody you'd want to talk to just to cover all your bases? Could you refer me to that person? So anything like that, you can ask the primary care. If you're not comfortable with that, that's okay too. They don't have to know that you're seeking a second opinion. So in that case, you can call your insurance company. If there's a big, academic medical center near you, and that's not where you'd been before, go to that medical center, call them up, go to their website, find the specialists, and they can set you up with that. And then even if your primary care even if your other doctor didn't know on the front end that you were getting that second opinion, it's okay. You can have your records sent over. You can choose to not have your records sent over, depending on who you want to go to for treatment. But your records are yours. So, does that kind of answer that question for second opinion, or is there anything else that I can address with that?
Yes, I have a question. When you get a referral for a specialist, what steps can you take to make sure you're getting the person that I'm going to say is the top specialist in that particular field?
Yeah.
Because I feel that doctors often will refer you to people that they know or that they're friends with, but that may not be the top person in that field. Is there a resource we can use to find the top person in that field?
It's a great question. So, number one, when you're getting referred, I would ask them, who are you going to refer me to and why? And see what they say for why. And then you can also say, I really want the top person in the field. If it's a surgery, who's the surgeon who's performed the most surgeries? Because that's the thing you want. You want someone skilled. So you can certainly ask that question. And then a great resource, major academic centers, just by and large, are usually going to have a lot of top people in their fields. So you can certainly, if you're near one, go and look. And usually they'll have the bios, see who the specialists are. You can call, let's say it's the gastroenterologist office. You can call that front desk and even say, who's the most experienced gastroenterologist? And it can also depend on kind of what you want. Do I want the most experienced person? Who's the person with the best bedside manner? You can ask those questions and they'll generally direct you there. And then of course there are resources like, trying to think through, Lisa, what is it, like US Health News? Is that one of the ones that publish different reviews for doctors? You can kind of find that all over the place. Sometimes though, I take those with a little bit of a grain of salt. What I tend to do is I'm going to look up, their education, how long they've been in practice. I do like to ask other providers. And I think asking that question, why are you referring me here and who's the top person? Because you're right, sometimes they may go to a friend, but most of the time, I think they're trying to refer you to a good person. And so getting that information about why, and I ask that a lot. I'll ask around for other providers. Hey, who do you think is the best over here? Is there a good resource you could think of online, Lisa, too, that would be beneficial to look up different providers?
I go like the Academy of Medicine, I'll go there sometimes and look. I go to I'm biased. I go to drug reps and I ask because they call on these clinicians and physicians. So I find people who have gone to cardiologists or somebody in the past. So I use other sources, but AMA resources most of the time. Sometimes I will reach out to the National Medical Association and see if they have recommendations, but different organizations like that.
Yeah.
To see what they recommend. But
And
Philip, that's a great
Excuse me,
question.
Lisa,
it is. Oh,
Mark,
sorry.
can I
Mark,
comment on that too? So, I mean, it is a fantastic question. I want to caution the audience because it is very, very natural and very usual for the person to say, I want the best doctor in the world for my situation. And in most cases, hopefully you can reach that person. But in some cases, depending on your diagnosis and the scenario you're dealing with, you don't necessarily need the best doctor in the world for that case. And you could be positioning yourself for some increased cost and some increased challenge trying to get to, say, the world's most talented surgeon to do something that might be fairly routine for a particular condition or particular scenario. So I think that second opinion really matters, and really just massaging out first what your scenario is, because you could find that you don't necessarily need, you don't need the master of all electricians to screw in a light bulb, right? And it may not feel like you're just screwing in a light bulb because you're the person who's enduring the challenge. But in some cases, the challenge is what they often refer to sometimes as a routine procedure or something. So you want the specialist that's appropriate for your condition. Does that make sense?
That is such a great point. It's a fabulous point. And that kind of goes to, thinking about, well, what am I looking for? So for example, there are lots of things that are really routine. Gallbladder removal is pretty routine. A lot of things that in those cases, no matter who you go to, the treatment may be pretty straightforward. And it's routine, just meaning, it's performed a lot. People are accustomed to it in that world. But when it's pretty straightforward, what you may want is the person who's going to have the best bedside manner, and the person who's going to respond to you, and the person who is close to where you live, and the person where the cost is down. And so it can really just depend on your situation. And I was going to add, when you're looking at that, so especially things like surgeons, you can, or oncologists, look and see what they're board certified in. So this kind of goes to Lisa's point, but let's say you've got, a hematological cancer. Well, look and make sure your oncologist is board certified in hematology. And you can Google that, and there are boards, you can look that up. I'll tell you, I had a really rare parathyroid surgery, and there are only very few surgeons trained in that. And so I just wanted to make sure, because it's such a niche surgery, that whoever I went to was board certified in that specific surgery. So I found 5 people in Nashville who were, and I just made sure I went to one of those people. And the way I chose one is I just got a referral from my endocrinologist. Well, who do you like? And then, she told me. So hopefully that's helpful, but you can always, look at there are always bodies like the American Academy of Plastic Surgeons or gastroenterology or whatever it is. So
A follow-up question. What is the resource that one could go to find out if a practitioner has had like a lot of lawsuits or just bad feedback on them?
That is such a great question. And I don't know that I'm even clear of how to find lawsuits or malpractice. So if anybody else wants to chime in terms of the reviews, I mean, it's interesting. I do kind of take things with a grain of salt, but nowadays, if you type it into Google, it seems like Google will aggregate reviews from patients from all over. So that can be, if you go in and type in a doctor's name and all the reviews are, not great, that might be a sign. So that's one way to look. And I see a hand up.
Yes, good afternoon. This is Clay Watkins. I think that was Phyllis that was asking the question. Was that you, Miss Phyllis? Yeah,
Yes.
one resource is the Virginia Health Department's website. You can go there and they have a page that will list all the licenses of the licenses of Dr. Hole, and if there have been any type of malpractice suits against them, that will be listed there as well. I can't tell you exactly how to navigate that website to that page. But if you go there, I think it's very user friendly. You should be able to find your way around to find what you want, but it's on any doctor that practices in the state of Virginia.
That's great. Thanks, Clay.
Sure.
Excellent.
Yeah, and that may be very state dependent. So that's great that that's there. I need to, I know I've tried to find that in Tennessee before and wasn't sure where to find it. And we don't have it on our licensure page, but that's great to know. It's probably very state dependent.
Yeah, and as we're trying to rebuild trust with physicians and establish the appropriate information, misinformation versus disinformation, Phyllis, that's a great question. I think we're all seeking to find those clinicians that are going to provide us with what we need and the way that we want to receive it. And we go back to the top 5 questions, the way that you develop your care plan or the decisions that are made is the decisions are not made arbitrarily by a physician. The decision is made with you so that your clinician and the nurse in the office, the nurse practitioner in the office should be willing to get to know who you are. From a don't be insulted if they're trying to understand your psychology, your socioeconomic status, all the things that would provide better access and care for you, because that's going to make a critical difference in what's done. And when Michelle, you were asking about a second opinion, as you're building rapport with that physician and the clinician who's helping to develop the plan, most physicians, as Leslie said, expect you about very serious things to seek a second opinion. So it's something that's going to be very customary. That's like, okay, I expect you to do that because of the diagnosis that it is. So that's my 2 cents on that. So
absolutely, it should be a partnership. And if it doesn't feel like a partnership, it's no one should be telling you what to do, or it should be a partnership. This is, you're part of the decision. And just I know for looking at time, I think the next most important thing, if when you look at this resource, you'll see seek out information, decide on a treatment plan. But I do want to mention the seek out information because it's so critical, where we seek out our information. And so Everyday Health, of course, we know that's a valid place. And then typically, if it's got a .gov or a .edu, then typically that's a good resource, a good place to seek out information. The official societies for certain things, like I mentioned, American Cancer Society, American Diabetes Association. So these places for Women's Health, it's ACOG, College of Obstetrics and Gynecology. Those places are going to be excellent places to seek information. You may, as you're finding support or just trying to find information, maybe you join a Facebook group of other patients, and that is great. It's great to be able to have that community, but also taking with a grain of salt, all the information you get there may not be completely accurate. So at the same time, I did want to mention the importance of community and support. So talking to friends about your diagnosis. However, if it is something that your friends or family don't fully understand, or they have difficulty talking about it, or they have difficulty with you expressing your feelings, because I've seen that happen. There are often support groups of other people going through the same thing, and that can be really helpful to have that, to just have someone where you can say, hey, I feel this way, and they feel the same way, and you can kind of encourage each other that way. And I also wanted to mention, in terms of support, and this is something more and more, I think, as we start to, on the medical side, really think about the whole person, because we try to do that more and more, thinking about therapeutic support if that's needed. So it can be great. It can be so great to talk to a counselor about any kind of diagnosis and bounce things off. So if you have an employer-sponsored health insurance plan, calling and just saying, is mental health covered? Who can I see? If you're Medicare or Medicaid, can call also community health centers. If something's not covered or you're not insured, community health centers, you often have sliding scales for that kind of thing. So I did want to mention that. And then, Lisa, what else should we touch on, or are there any questions?
I have one more question.
Mhm.
Sometimes you are prescribed medications or drugs that are very, very expensive. At one time, I had a drug that was about $2,000 a treatment. And I told them, I hate to say this, but I said, well, I'm just going to have to die. But I found out that there was a the drug company actually gave me a subsidy. So it made it more cost effective. But I'm just wondering if how would you go through finding out if what you're being prescribed is something that the drug company would give you a subsidy on?
This is a fabulous question. And this is one of the most convoluted parts of our healthcare system. And, often the prescriber, the providers, they have no idea, because it can vary so much from insurance company to company, formulary, what your plan is. So for that type of thing, number one, yes, especially with a lot of expensive drugs, the drug company has all sorts of access plans. So you can just type in, into Google the name of that drug, and you could add to that, access and see what pops up. You can, at your doctor's office, there's typically someone who does what they call prior authorizations. So that's the person who's calling the insurance company. You can say, hey, can I speak with either the patient advocate or the person who works with the insurance company? One of those people will typically have all the information about drug access. If it's a specialty pharmacy, so like say you're getting a cancer treatment and it goes through typically a specialty pharmacy, an oral treatment, they will have all that information. You just need to ask for it. But Lisa, I would say, I think one of the easiest ways is Googling. Don't you think? Just the drug, and then going for patient. There's always kind of a patient information site on the websites, and you can click through.
And you can always reach out to the manufacturer and ask if they have programs, medication programs or assistance programs. So that's one way to always go and look. What you've just brought up, though, Phyllis, is another topic for this group. We need to understand the roles of everybody in the offices that we go to, so that when you're in there, what is the role of the nurse practitioner, the physician assistants, the social worker? What are they going to do? The financial counselor, what are they going to do? To understand how each of those roles can better assist and support us in what you're doing. Because the whole purpose of being on this call is to become educated, empowered in the way that we make decisions, and to help the next person sitting beside us make these same decisions. So I'm going to take it upon myself to add a conversation about the role of healthcare providers, who they are in the office, and what they do and how they support us. Because I think that would be very helpful for us based on what was said. So yeah, good RX. That's right. Yep.
Good RX will often, you put in the drug and you can put in your location, and it will have the various prices at pharmacies around you, and often will have information if there's patient access to that.
Needy
So that's
meds,
a great one.
needy meds and good, yeah, good RX, but needy meds. But always go to a manufacturer.
Mhm.
You call that 1-800 number. And Juanita, you can vouch for A.H. Robbins, and knowing that if that was the case, if you need something, you can reach out and find. Don't hesitate. And you can also go to your pharmacist.
Mhm.
Go to the local pharmacist and say, hey, do you know of another way that I might not be able to access this? I don't want to stop this medication. It's very expensive. Maybe it's not a generic. Do they have a program? Do they have samples? A lot of places don't have them anymore, but those are ways that you can also seek to
And
find
if you,
out.
and if you don't know who the manufacturer is, like if you already have the medication, it will be on there. If you don't know, that's where you can type in, I'm just going to say Ozempic or Wegovy, and Novo Nordisk is the manufacturer, but it'll take you to that. And so that's where you can find, there's a number somewhere, and usually it's called patient access. So even, you can type in those terms, but that's where you can find that information. That's such a great question.
Yeah. We have reached our time once again so quickly.
Oh, gosh. Yeah, could I just make one comment? I know we're a minute over.
No, go right ahead.
Just as a follow-up to Mary's great point about the MyChart thing, technology is something, but in listening to what you've covered today in terms of giving us information, or not just information, but questions to ask and to be prepared, and maybe even to have somebody else with you. If you do happen to see that thing out there, I guess after you fall out and get all upset and cry and whatever else, and pull yourself together, then maybe we can look back at our notes and say, okay, what do I need to do with this when I go in there? Because the doctor doesn't have a lot of time, or they don't, they give you 10 minutes or whatever for your appointment. So that's what makes this session, I think, so good, because we can be more prepared to be proactive in our healthcare. So Mary's point is definitely well taken. The MyChart thing could scare you to death.
Yeah.
But it could also help you prepare based on what you're doing for us here.
I love how you said that, and just, you said you can cry and then go, what can I do? And one of my main points that I didn't get to, but it reminded me of that, is this is what you can control. Focusing on what you can control is so huge. And that is exactly what you're talking about, like making sure you're prepared. What can I control? What can I do? How can I make this situation the best situation? I love that.
And if I could give you just a 15-second addition to that MyChart reading that I got. And when you see it, there are certain words that stick out. So for me, and I don't mind putting it out here, to me, it was brain, it was surgery, and mass. So I didn't see anything else. The other part of it, before I can reach my doctor, I got a phone call from a surgeon to make an appointment. So by then I am over the edge. So like Juanita said, you got to pull yourself together and wait until you can talk to the doctor. I don't want to talk to the receptionist to make an appointment for what I see is brain and surgeon. And in the end, it was something like not nearly as bad as I had envisioned. I mean, in the first couple of hours that I read it on my chart, but just want to throw that out there.
And
Yeah.
Lisa, you might be able to, maybe one other day for discussion. United Healthcare has something now where they send out a person to your house, and they have something where you can call 24/7 if you have a question. I guess this is something new. Have you heard of Landmark Healthcare?
I have not.
Okay,
I
anyway.
have.
Okay, good. And
Mhm.
I thought that was good because like Mary said, by the time you read and think the worst and everything, now, I don't know if this is just United Healthcare where the other insurances are coming up with where you don't have to wait until the 9 o'clock the next morning. You can call this number, they say 24/7,
Yeah.
and get something or get someone to answer that can give you maybe some peace of mind and maybe you'll.
I am sure that they have
Humana,
it,
Humana.
Juanita,
Humana.
because nurses work all shifts. So I'm sure that United has hired a nurse or somebody to work that night shift to cover that kind of that 24/7 need. But we are a society, a generation now that wants things immediately. It's not like it was once upon a time. So I'm sure that there will be more healthcare organizations that provide what we need when we want it so that it's convenient. And I'm going to use the word customized so that it feels like you want it to feel. But our role for each other is to be a part of the decision-making process to understand what we are experiencing and help in that decision-making and how we move forward. And your charge is to help the next person sitting next to you, not just yourself. You bring somebody else along. And I like this, we are people first before we are patients. And so what we are doing here is empowering ourselves around what this is before we need it. So that when we do need it or somebody else needs it, that's what we're doing. So thank you for joining today. I want you to remember that the information is coming to you in email now. It won't just come from, say, an organization like Reverend Waddy sending it out, but I've used your email. Go to spam, look for that. It's coming from bereave.org, which gives you the trigger or the reminder of that. And next month, we're going to have another special guest. Leslie, you are super special, but you're a part of this team. So, we get to call on you all the time when we need you in this way. But Dr. Bayo Curry Winchell is going to come to us to speak about hypertension and allow you to do Q&A on that with her, just like we did here. So the invite will be coming out a week before. And don't forget the Afro Males conversation that is, I think, every other week, but it's on Bereave. You should be able to find that conversation on Bereave as well. Everyday Health is your partner. It's your friend. And I loved what Leslie said about anything that is .edu or .gov is also very safe. I like Everyday Health because it speaks in a way that I understand. And I can explain it to somebody else. Thank you once again for joining and spending the time with us. Leslie, we thank you for bringing your expertise and knowledge. And please do not forget the resource that has the 10 questions in it. The Agency for Healthcare Research and Quality will be on the Bereave website. One note, we are archiving these conversations so that they are on the website for 2 months and then we drop them. We probably shouldn't drop them. We'll work on that, but you know, the space and all of that, we have to grow to a place that we can hold more of these. Is there anything else that anybody wants to bring up before we go? Hugs and kisses. Thank you, everyone. Okay, we'll see you
Bye,
next,
everybody.
next fourth Wednesday. All righty.
Thank
Right.
you.
Bye-bye.
Bye.